This is the Dr. Ravi Sani. Our today's discussion is about functions of bile. Now, the first important function is the digestive function. The second one is the absorptive functions. Third one is the excretory functions. So, digestive and absorptive functions we have studied in previous classes, especially related to emulsification of fats. That is emulsification of fats, which helps in absorption of fats. The third function is the excretory functions. Now, bile pigments are the major excretory products of the bile. Some other substances could also be excreted, like heavy metals. In heavy metals, there is copper and iron. Some bacteria, like typhoid bacteria, are commonly excreted. Toxins, cholesterol, lecithin, alkaline phosphate, and there is a numerous substances which could be excreted through the bile. Some other functions are uh, laxative functions, because bile salts acts as laxatives, which helps in a smooth passage of feces or prevents constipation. So bile also, especially bile salts which are present in bile, act as laxatives. Next function is the antiseptic function. So antiseptic means inhibition of the growth of bacteria in the lumen of intestine by detergent action. So bile also have antiseptic functions which inhibits growth of specific bacteria. The next function is the cholerectic action, which increases secretion of bile. That is cholerectic action. Bile also helps in maintenance of pH in GIT. Basically, bile is highly alkaline, so it neutralizes the acidic nature of the chyme. When bolus, when food is present in mouth, it is called bolus. When it shifted to stomach, there it is called chyme, because in stomach, due to secretion of gastric glands, it has acidic environment. That's why it is called as acidic chyme. When finally it enters the intestine from stomach, then to maintain the action of digestive enzymes, optimum pH should be maintained. And for maintaining of this optimum pH, the alkaline nature of bile helps. The next function is the prevention of gallstone. Bile salts prevent the formation of gallstone by keeping the cholesterol and lecithin in solution or soluble stage. So it helps in prevention of gallstone. In the absence of bile salts, cholesterol precipitates along with lecithin, and which finally forms gallstone. Lubrication function means smooth passing of food in intestine. The next function is the cholagogue action. Cholegogue means it increases secretion of bile by increasing contraction of gallbladder, which finally releases bile into the intestine. That is cholegogue action. Cholerectic action basically increases secretion of bile by production in liver, and cholegogue, it increases secretion of bile by increasing contraction of gallbladder. Now come to the metabolic functions. So liver is the organ where maximum metabolic reactions occurs. This is the most important function of the liver. So maximum metabolic reactions occurs in the liver, especially related to carbohydrate, protein, fats, vitamins, hormones, and drugs also. When we take medicines, so these medicines are also metabolized in liver. The next function is a storage function. Glycogen, amino acids, iron, folic acid, vitamin A, B12, D, all these substances are stored in liver. So liver has storage function. The next, metabolic function, storage function, synthetic function. So liver is the organ where maximum metabolic reactions occurs, especially related to carbohydrate, proteins, fats, vitamins, and hormones, including drugs. Liver also acts as a storage organ. It stores glycogen, amino acids, iron, folic acid, vitamin A, B12, D. All these substances are stored in the liver. The next function is the synthetic function. So it synthesizes plasma proteins except immunoglobulins, which are related to the immunity, which provides defensive functions, clotting factors, complement factors, hormone binding proteins. All these are basically steroids, somatomedin, heparin. All these are basically synthesized in liver. Next function is the secretion of bile. So basically, production liver cells secretes bile, which contains bile salts, bile pigments, cholesterol, or fatty acids, and this bile basically stored in gallbladder. Secretion is done by liver, and storage is done by gallbladder. Basically, bile salts, which are present in bile, are responsible for important functions of bile. Bile salts especially helps in digestion and absorption of fats by emulsification of fats. Bile also helps to carry away waste products and breakdown of fats and are finally excreted through feces or urine. Now come to the excretory functions. As liver is responsible for various metabolic functions, so after completion of these metabolic reactions, so many toxic products are produced. So liver is also responsible for excretion of these toxic products: bile pigments, excessive cholesterol, heavy metals, lead, arsenic. These are some common examples. Some other materials could also be included. Toxins, bacteria, virus are also excreted through the liver. Heat production, because of metabolic reactions, heat is produced in the liver, which helps in maintenance of body temperature. Now there is a hemopoietic function. In fetus or hepatic stage, liver produces blood cells. In adult stage, it stores vitamin B12, which is necessary for erythropoiesis, means formation of RBC. So basically, vitamin B12 helps in erythropoiesis, and this vitamin B12 is stored in liver. Iron is that is necessary for synthesis of hemoglobin, is also stored in liver. Liver produces uh, thrombopoietin, which promotes production of thrombocytes. Hemolytic functions means uh, RBC, after when its lifespan has completed, then it is destroyed by reticular endothelial cells or Kupffer cells of liver. So it has hemolytic function, means breakdown or lysis of RBC. Sorry. The next function is the inactivation of hormones and drugs. As most of the metabolic reactions are done in the liver, especially related to hormones like growth hormone, parathormone, cortisol, insulin, glucagon, estrogen. So all these hormones are catabolizes in liver. Liver also catabolizes or inactivates various drugs, particularly those drugs which are fat soluble. Fat soluble are converted into water soluble substances, and finally, these toxic toxins which are produced by the metabolism of drugs, these toxins are converted into water soluble substances and finally excreted through bile or urine. The next function is the defensive function and detoxification function. Kupffer cells, which are present in the liver, play an important role in the defense of the body, and it also helps in detoxification of the foreign bodies. Uh, Foreign bodies could be bacteria or antigens. These are swallowed or digested, means or digested by phagocytosis. So basically, Kupffer cells through phagocytosis destroy these bacteria or antigens. Kupffer cells also secretes interleukins, tumor necrosis factors, which activate the immune system of the body. Basically, we could say reticular endothelial cells of liver produces interleukins, tumor necrosis factor, and activates the immune system of the body. Liver cells also involved in removal of toxic property of various harmful substances. So removal of toxic property of harmful agent is known as detoxification, that is done by the liver. Detoxification means when uh, toxic substances are metabolized, they could be converted into less toxic substances and finally excreted through urine or feces. Here we have an idea related to detoxification. So detoxification in the liver occurs in two ways. The first one is a total destruction of substances. Substances are completely destroyed. The second one is a conversion of toxic substances into non-toxic materials by means of conjugation with glucuronic acid or sulfates. These two mechanisms helps in detoxification by liver. Now come to the physiology of applied physiology, that is specifically related to liver or gallbladder disease. The first one and the most important is the jaundice or icterus. So basically, it is a condition which is characterized by yellow coloration of the skin, mucous membrane, or deeper tissues. So basically, there is increased bilirubin level in blood. The word jaundice basically means the term here John means yellow. So from this term, this has been derived, jaundice. Jaundice. So basically, jaundice is the condition where which is characterized by yellow coloration of the yellow coloration of the skin, mucous membrane, or some deeper tissues. The normal bilirubin level, it is around 0.5 to 1.5 milligram per deciliter. This is a normal value of serum bilirubin. In case of jaundice, this bilirubin level exceeds more than 2 milligram per deciliter. Now come to the jaundice, types of jaundice, which could be classified into pre-hepatic, uh, hepatic, or post-hepatic. Pre-hepatic is also known as hemolytic jaundice. Hepatic, also called hepatocellular jaundice. The third one is the post-hepatic or obstructive jaundice. Here we are taking pre-hepatic or hemolytic jaundice. So due to excessive destruction of RBC, results in increased level of bilirubin in blood. Due to excessive destruction of RBC, there is excessive formation of bilirubin. So this excessive formation of bilirubin finally stored in blood. So in this, excretory function of liver is normal, but bilirubin level increases in blood because of this excessive destruction of RBC. In prehepatic or hemolytic jaundice, there is no hampering of liver functions. Liver functions are normal, but excessive destruction of RBC is responsible for the increased level of bilirubin in blood. Unconjugated bilirubin is insoluble. That's why it is not excreted in urine, so it accumulates in the blood, which results in a condition called jaundice. So basically, this excessive destruction of RBC is could be understood as hemolytic anemia. This condition could be called hemolytic anemia, where excessive destruction of RBC is occurring. So this condition could lead to hemolytic jaundice. The second category is the hepatic or hepatocellular or cholestatic jaundice. In this type of jaundice, actual damage of hepatic cells occur. So, conjugated bilirubin will not be excreted through liver in intestine, and finally it returns to blood and and it causes a condition called jaundice, because hepatic cells are not functioning properly, so liver cannot excrete this conjugate bilirubin, and this conjugate bilirubin finally stored in blood and uh, causes the condition called jaundice. Some common causes of this hepatic jaundice could be infection by virus, uh, which results in hepatitis, alcoholic hepatitis, cirrhosis of liver, exposure of toxic materials. Such kind of uh, factors is responsible for damage of hepatic cells, which results in hepatic or hepatocellular jaundice. The last or the third type of the jaundice is post hepatic jaundice or extra hepatic jaundice. In this type of jaundice, basically there is an obstruction of bile flow. There is an obstruction of bile flow. So the bile cannot be excreted into small intestine. Bile salts and bile pigments finally enters the circulation, and this conjugated bilirubin finally, because bile salts or bile pigments are not excreted into the intestine, they return to circulation, where these bilirubin, that is bile pigment, finally accumulates in blood. Some common causes of post-hepatic or obstructive jaundice is gallstone. Gallstone is responsible for obstruction of bile ducts. Cancer of biliary system or pancreas. Some other condition could also be responsible for post-hepatic or obstructive jaundice. In this chart, all the differences between these three types of jaundice is mentioned. The next condition is the hepatitis. So basically, there is a liver damage which is caused by swelling or inadequate functioning of liver. And this hepatitis could be acute or chronic on the basis of duration. It could also lead to uh, fatal situations like liver failure or death. Some common causes of hepatitis are viral infection, that is really important. Bacterial infection could also lead to hepatitis, specifically like leptospirosis. Excessive consumption of alcohol is the commonest cause for destruction or damage of liver cells. The next condition is the gallstone. So basically, these are the stones which formed by cholesterol, calcium ions, bile pigments, and gallbladder, or it could be formed in bile ducts. So cholelithiasis condition is it is a presence of gallstone in gallbladder. So this condition, presence of gallstone, could be known as it is known as cholelithiasis. Common causes for gallstone formation are reduction in bile salts or lecithin, excessive cholesterol, disturbed cholesterol metabolism which is responsible for digestion of cholesterol. If it is disturbed, then it could also be responsible for formation of gallstones. Excessive calcium ions due to increased concentration of bile. In excessive condition, gallbladder has to be removed. That is called cholecystectomy. Laparoscopic surgery is a common method which is used for cholecystectomy. In this image, how gallstone formed could easily be understood. Some common causes of the gallstone formation are absorption of water from bile, too much absorption of bile acids from bile, too much cholesterol, inflammation of epithelium. So these formation of stones, like here, here, they are causing obstruction of these ducts. Gallstones could also be formed in this portion.